The sensation, I was actually really surprised. Probably within a month, I had a lot of sensation. At first, it's a little bit too sensitive, I guess. That's with the skin probably growing back over, but that settles down. So sensation, yeah, I'd say it probably was about a month before I could orgasm. I was quite surprised. And with maybe 3 months to 6 months, I think it did actually settle down, and I feel like I could actually have all the sensations that I was expecting. That was internally and externally, yeah. That's another thing that really surprised me actually. Lubrication isn't a problem at all actually. I guess it is a little bit personal. I get quite wet. I guess I was quite surprised that it was just like a natural female actually. Very, very surprised. I don't actually have to use a lubricant to have sex, which is very, very surprising actually. I never expected it. Now I understand that it comes from the Cowper's gland, which is basically a naturally born male would have. So it's fantastic. Okay, when the packing was removed, I can't remember the exact depth, but it's actually got bigger actually since I've had the surgery. I was told that it could actually shrink a little bit if I didn't actually dilate and take care of it. But I've actually been very careful actually and made sure I've done all the things that Dr. Cheddarwood actually asked. Maybe I wasn't probably as good at the start, but I've actually kept that dilation up even now after 4 years. That's right. Not exactly. I didn't follow the schedule completely because I guess I worked, so I couldn't do it during work hours, which is probably what was expected. The thing I actually did do was make up for it, say at night, would I actually do extra time in dilation. And now I guess the depth actually that I found out yesterday was 6.5 inches, which was a lot more than what I think it was about an inch more than I started off with. So I think it does show that if you actually do what Dr. Cheddarwood asks, you actually will have a really fantastic outcome. Sure. I saw a gynecologist probably about 6 months ago. I had a tiny little bleeding, which was probably my fault. It was from sex. But when I actually visited her, she was actually amazed. She's, I guess, the gynecologist registrar at the hospital, so I guess she has a lot of experience of seeing natural female vaginas. She actually said from the outside she could not tell any different. She was quite amazed actually. She said it wasn't until she actually examined inside that she could tell the difference. Her advice was basically, she didn't actually have a lot of experience to do with transgender women. I think I was probably the first woman she'd actually seen like me. But she did actually prescribe me like an estrogen cream, which actually has made a lot of difference. And I guess for dilation it softens the skin. I believe Dr. Cheddarwood said there could be some problems in that, but so far so good for me. But from her experience, she said the actual surgery, you could not tell the difference between a natural female and myself. Okay, so the breast augmentation I think was probably more painful than the SRS, which probably sounds completely strange, but I guess the technique of pushing the implants behind your muscle, look, it's a fantastic outcome, but I guess we have to understand it is actually going to be quite painful after the surgery. That went away after about a week, so that was maybe even less than that, a few days. So that was a little bit of a surprise, but when it extended out, it disappeared, the pain, so yeah. I'm very satisfied, yeah. I guess partners thinks it's fantastic, so thinks it's a really wonderful job, and it might sound really strange, but I guess other female workers at work, we've actually compared, because they've had actually breast implants back in Australia, and they think it's a better job than what they actually got back in Australia, yeah. Okay. With the massaging, I probably wasn't as dedicated as I was with the actual dilation. I did actually do it for probably the first 3 months quite often and quite regularly. I feel that I probably should start it again because I know from talking to the doctor that keeping it soft is important. Yeah, so... No, I had no problems after surgery. I guess a lot of the surgeons in Australia, they cut underneath the breast and put the implant in that way. I've had friends who've had problems with that, but having it put underneath the armpit, no, I didn't have any problems actually, and the healing was wonderful. And as I said before, I started playing soccer, which was naughty, within 3 months, and with a good sports bra, but it was perfect, yeah. Okay, to be honest, I can't remember the exact implant now. I wanted about a B or a C cup. I actually got the implants fairly early on in my transition. As I said, I started transitioning only probably 9 months before I had all my surgery, because I changed quite quickly. But I've had an extra, I guess, more breast tissue now, so now I'm about a D cup, which I'm quite happy with. But well, I guess the question about the actual implants itself, I'm aware that Dr. Cheddarwood uses a very safe implant. I know there's some concerns in Australia about some breast implants right now that have been linked to cancer, but I'm aware that Dr. Cheddarwood doesn't actually use those types of implants.